Welcome to part 3 of diabetes. This is going to focus on the complications of diabetes. There are many complications related to diabetes, but one of the more common complications is hypoglycemia. Hypoglycemia is when the blood glucose level falls to less than 70 milligrams per deciliter. It can occur if the patient took too much oral or injectable medications, ate too little food, or did too much exercise. One thing to be mindful of is sometimes people can have symptoms of hypoglycemia at levels higher than 70. It really depends on how high their blood glucose was before the level dropped and what their average blood glucose is. So while we use 70 as the diagnostic number, it can occur at higher numbers. Another thing to know is that some people can become hypoglycemic but don't have any symptoms until it gets really dangerously low. The symptoms of hypoglycemia typically include being shaky, cold, and clammy, dizziness, headache, nausea, weakness. They can't think properly, and some may complain of numbness in their lips and their tongue. Some may develop tachycardia and palpitations. If hypoglycemia isn't treated immediately, the patient may have seizures, lose consciousness, and death is possible. The term hangry is a great way to describe somebody who's starting to have their blood sugar drop. Hanger is caused by hypoglycemia from not eating. Treating hypoglycemia involves checking their blood glucose level and giving them some glucose. The quote is, "Cool and clammy, give them candy," except we don't want to actually give them candy. We want to give the hypoglycemic person about 15 to 20 grams of a fast-acting carbohydrate, like 4 to 6 ounces of a regular non-diet soda, 4 to 6 ounces of orange juice, 2 tablespoons of raisins, or even 8 ounces of non-fat or low-fat milk. We really want to follow these quick treatments with some sort of balanced protein and carb snack or a meal to help keep their glucose levels up. We don't want their glucose levels to drop again. In addition to these types of foods, there are a number of commercially available glucose tablets and gels. The benefits to using commercial products are they aren't as tempting to snack on as candy is. They also contain no fat, and fat can slow down digestion, and they don't have fructose, which has a smaller and slower effect on blood glucose. Also, the commercial products are standardized, so it's easy to measure out a dose of 15 grams of carbohydrates. If the person is not improving after the initial dose of carbs, we'll repeat it again in 5 to 15 minutes. And if that doesn't work, we're going to call EMS and get that person to the emergency department. If it does become an emergency situation, or they can't swallow, or they're unconscious, we will administer 1 milligram of glucagon subcutaneously or intramuscularly. We give glucagon because it causes the liver to release the sugar it has stored, and that's going to help increase blood glucose levels. If they're doing really badly, we give them 25 to 50 milliliters of 50% dextrose solution through their IV. Another complication of diabetes is hyperglycemia. Yes, I know diabetes is hyperglycemia, but this complication is when their blood glucose levels are above 240 milligrams per deciliter and they're having issues because of it. If the person has acutely high blood glucose levels, they may have blurred vision, fatigue, the 3 Ps, ketoacidosis, and potentially abdominal pain. If they have chronically high blood glucose levels over 240, they may have fatigue, the 3 Ps, increased infections, weight loss, blurred vision, and end organ complications. The treatment of hyperglycemia is to get the blood glucose levels down. We can use oral anti-hyperglycemics or insulin by injection, IV, or even insulin pumps. The next PowerPoint in this series is dedicated to these treatments, so I'm not going to discuss them here. In addition to medications, we need to hydrate the person with a calorie-free fluid like water. Oral is the best preferred route, but IV may be needed. Remember, hyperglycemia causes osmotic diuresis, so they are losing a lot of fluid. Long term, the person needs to follow a proper diabetic diet, exercise, monitor their ketones if they have type 1 diabetes, and they have to self-monitor their blood glucose levels. If we do not get the high blood glucose levels down and keep them down, the person is going to develop end organ complications. The only way to prevent end organ complications is to get the sugar down and keep it low. End organ complications happen for a couple of reasons. First, the body has a chemical called nitric oxide, which is released from the blood vessels to help them dilate for optimal blood flow. High blood glucose levels diminish the release of nitric oxide, causing the vessels to become narrow, limiting the passage of blood. Limited passage of blood means less oxygenated blood getting to the tissues and cells, which means cells do not get the oxygen they need and they start to have damage and they start to die. Another reason why end organ complications occur is because the glucose molecule is large. As glucose saturated blood passes through the microvasculature of the body, these large molecules bump into the endothelium, causing damage to the lining of the vessels. When our vessels suffer an injury, our bodies make deposits of cholesterol to protect itself from further damage. Those cholesterol deposits get larger and they start to clog up the vessels, and these are called plaques. This is going to make the vessels narrower, causing less blood flow. These cholesterol deposits start a disease called atherosclerosis, which limits the blood flow within the vessels. All of the limited blood flow to the tissues and cells cause significant damage in the body. We call this end organ damage, and there are 3 types. I'm going to briefly explain them here, but you're going to learn more about these in depth in later blocks. First, we have macrovascular complications. These are accelerated atherosclerotic changes inside large blood vessels that cause coronary artery disease, cerebrovascular disease, and peripheral vascular disease. The lack of blood flow will also cause delayed wound healing. Next, we have microvascular complications. These are damage to the tiny blood vessels in our bodies. These can occur in our eyes, causing diabetic retinopathy, and in our kidneys, causing nephropathy and kidney failure. The third complication is neuropathic. This is when our nerves get damaged, which causes peripheral neuropathy, autonomic neuropathies, hypoglycemic unawareness, neuropathy, and sexual dysfunction. Peripheral neuropathy can make it so a person cannot feel their feet, what makes them higher risk of damaging their feet. The damage won't heal appropriately, and they're going to develop neuropathic ulcers called diabetic ulcers. I just want to add a little bit more about diabetic retinopathy. Diabetes is the leading cause of preventable blindness in adults. All diabetics are at risk of developing this, but type 1 diabetics are at higher risk. To prevent this terrible disease, we must have good control of the blood glucose levels. These patients must also have routine ophthalmic evaluations with an eye doctor, like every 6 months to a year and more frequently if needed. This type of blindness is not reversible, so once it happens, the person will never regain their vision. And this is the end of part 3 of diabetes.